After 60, certain surgeries that are marketed as safe, covered by insurance, performed every single day, can permanently change your body's ability to heal, not temporarily, permanently. I'm Dr. Markus Dexter, and after 15 years of tracking what happens to patients 6 months, 1 year, and 2 years after these procedures, I can tell you the risks are not being disclosed. Today, I'm walking you through 5 surgeries that doctors recommend to seniors every single day, and the evidence-based alternatives that most physicians never mention. Stay until the end, because number 1 on this list is performed over 450,000 times a year in the United States alone, and a 2022 study found the complication rate in patients over 80 is 28%. Complications that include infection, fracture, blood clots, and death. That number was buried in the fine print. Here's why this matters specifically for your body right now. After 60, your body produces 40% less collagen, the protein that closes wounds and repairs tissue. Your immune system is 35% less efficient at fighting infection. Circulation slows, meaning oxygen and nutrients reach surgical sites much more slowly. When you combine anesthesia exposure, surgical trauma, and reduced healing capacity, you create a cascade of complications that a 5-minute consultation will never cover. The medical system measures surgical success by whether you survive the procedure. It does not measure whether you can still climb stairs, drive yourself to the grocery store, or live without chronic pain 6 months later. That's what I measure, and what I've seen has changed how I practice medicine. Before we go through the list, have you or someone you love been told you need surgery? If a doctor has recommended any procedure in the last year, type the word surgery in the comments right now. I read every single one. Let's see how many of us are facing this decision. Number 5. A surgeon inserts a tiny camera into your knee joint to clean up damaged cartilage and smooth rough surfaces. Minimally invasive, logical sounding. Your knee hurts. The cartilage is damaged. So remove the damaged parts, right? Wrong. And the evidence is unambiguous. Osteoarthritis is not caused by loose cartilage fragments. It is caused by the progressive breakdown of the joint itself. A 2017 study published in the New England Journal of Medicine followed 351 patients with osteoarthritis who had arthroscopic knee surgery. 2 years later, their pain levels were identical to patients who had only received physical therapy. Identical. But the surgery group also had additional joint trauma, anesthesia exposure, scar tissue, and in 22% of cases, patients said their knee felt worse after surgery than before. The alternative works. A combination of targeted physical therapy, anti-inflammatory nutrition, and supplementation with glucosamine and chondroitin has been shown to reduce knee pain by up to 38% within 3 months. No incisions, no anesthesia. No recovery period. Here's the key insight. After 60, your body has a remarkable capacity to adapt, but it needs the right support, not surgical interruption. Surgery forces your body into emergency repair mode when it should be in gradual strengthening mode. Number 4. Surgeons permanently join 2 or more vertebrae using metal rods, screws, and bone grafts. The promise: eliminate movement between painful vertebrae, eliminate pain. Here is what they don't tell you. Fusing vertebrae transfers mechanical stress to the joints directly above and below the fusion. Research published in the Journal of the American Medical Association found that within 5 years of spinal fusion, 38% of patients develop significant problems in those adjacent vertebrae, problems that often require additional surgery. And here is the study that should be in every pre-surgical consultation. A 2019 trial compared 2 groups of patients over 60 with chronic lower back pain. Half received spinal fusion, half received intensive physical therapy, core strengthening, and structured pain management. After 2 years, both groups reported similar pain levels, but the physical therapy group maintained far greater mobility, experienced 0 surgical complications, and saved an average of $87,000 in medical costs. Same pain outcomes, no surgery, no metal hardware in the spine, no permanent restriction of movement. The fusion is irreversible. The mobility you lose, you do not get back. That is not a risk factor. That is a certainty. And it is a certainty that is rarely communicated before you sign the consent form. If this information is valuable to you, hit the like button now and subscribe. I publish evidence-based health content for people over 60 every single week. What I'm about to share next is something your surgeon will almost certainly never bring up. Let's keep going. Number 3. Cholecystectomy, gallbladder removal, is one of the most common surgeries in America, with over 600,000 performed every year. And here's the problem. Many seniors are told they need it simply because an imaging scan found gallstones, even when those stones are causing 0 symptoms. Your gallbladder has a critical function. It stores and concentrates bile, which helps you digest fats and absorb fat-soluble vitamins A, D, E, and K. Remove it, and your body permanently loses that concentrated delivery system. According to research published in Frontiers in Aging, up to 40% of people over 60 have gallstones. But the majority of those stones never cause any problem. Studies show that only about 20% of people with silent gallstones ever develop symptoms, which means if you remove your gallbladder just in case, there is an 80% chance you are removing a functioning organ for no medical reason. What happens after removal? A 2021 study found that 47% of patients who had their gallbladder out experienced chronic digestive problems, persistent diarrhea, bloating, and difficulty absorbing nutrients. For seniors, malabsorption accelerates muscle loss, bone density decline, and cognitive impairment. These are not minor inconveniences. If you have gallstones but no symptoms, no pain, no inflammation, the answer is dietary management, not surgery. Increase fiber, reduce saturated fats, stay hydrated. Bile-supporting herbs like dandelion root and milk thistle have solid evidence behind them. After 60, preserving every functioning organ should be the priority. Number 2, open heart surgery. They stop your heart, connect you to a bypass machine, and graft blood vessels to reroute blood around blocked coronary arteries. For patients in acute crisis, this surgery saves lives. I want to be clear about that. But for seniors with stable angina, chest discomfort that is predictable and controlled with medication, the evidence says something very different. The COURAGE trial, a landmark study published in the New England Journal of Medicine, followed over 2,000 patients with stable coronary artery disease. Half received bypass surgery or stenting, half received optimal medical therapy, structured medication, anti-inflammatory nutrition, stress reduction, controlled exercise. After 5 years, there was no difference in death rates or heart attack rates between the two groups. None. For stable angina, invasive surgery provided zero survival benefit over medication and lifestyle management. And here is what concerns me most specifically for seniors. Studies show that up to 50% of patients over 70 experience measurable cognitive decline after open heart surgery, likely from time spent on the heart-lung bypass machine. Some recover, many do not fully. If you have stable angina, meaning your symptoms are predictable and medication is managing them, ask your cardiologist this question directly. Is there evidence that surgery will extend my life, or will it only address my symptoms? The COURAGE trial answer is on record. You deserve to know it. Number 1. Over 450,000 Americans have hip replacement surgery every year, the majority over 60. And it is marketed as a straightforward solution to hip pain. Here is what the glossy consultation brochure does not cover. A total hip replacement is exactly what it sounds like. The ball of your hip joint is removed, the socket is reamed out, a metal stem is hammered into your femur, a metal or ceramic ball is attached. Your hip socket is lined with plastic or ceramic. You now have an entirely artificial joint with a finite lifespan. Modern hip replacements last an average of 15 to 20 years. For someone who has the surgery at 65, that means revision surgery, removing and replacing the implant, at 80 or 85. Revision surgery is dramatically more complex, more dangerous, and has far lower success rates than the original procedure. According to a 2022 study in the Journal of Applied Physiology, revision hip surgery in patients over 80 carries a 28% complication rate. That includes infection, dislocation, fracture, blood clots, and death. And here is the part that I find hardest to accept. The vast majority of seniors recommended for hip replacement have moderate arthritis pain, not severe disability. They are still walking, they are still functioning, they have discomfort and reduced range of motion, but they have not exhausted the conservative options available to them. The science on those options is compelling. A study published in Nutrients found that a combination of glucosamine, chondroitin, and collagen supplementation reduced hip pain by an average of 43% within 12 weeks in patients with moderate osteoarthritis. Another study in the Journal of Clinical Nutrition found that seniors who engaged in daily low-impact exercise combined with omega-3 supplementation experienced pain reduction equivalent to anti-inflammatory medications without the gastrointestinal risks. And here is what hip replacement takes away permanently. The artificial joint does not replicate the range of motion of your natural hip. You cannot cross your legs. You cannot squat fully. You cannot pivot aggressively. These are not temporary post-surgical restrictions. These are permanent limitations you carry for the rest of your life. Before accepting that trade, every conservative option deserves a genuine trial. If you believe conservative treatment deserves a real chance before surgery, type yes in the comments right now. Your response helps other viewers know they are not alone in asking these questions. Here is my 3-step action plan for anyone facing a surgical recommendation. First, always get a second opinion. Not from another surgeon in the same practice, from an independent physician who does not benefit financially from your decision. Second, ask these specific questions before agreeing to anything. What happens if I wait 6 months? What conservative treatments have I not yet tried? What are the specific complication rates for someone my age, not the general population? Third, give conservative management a genuine 90-day trial, daily, glucosamine sulfate, chondroitin, and curcumin with black pepper for absorption. 20 minutes of low-impact movement, swimming, cycling, tai chi. 2 grams of omega-3 fish oil, 10 grams of collagen peptides in water or tea. This is not about avoiding all surgery. Some procedures are genuinely life-saving and there is no alternative. This is about making sure that when surgery is the answer, it is because every other option has been properly explored, not because it was the first option on the table. Pain is your body's communication system. It is not an automatic surgery indication. You have more options than the consultation room suggests. We have covered 5 surgeries that are presented as routine, and the evidence behind why a second look is always warranted. Arthroscopic knee surgery that studies show provides no long-term pain advantage over physical therapy. Spinal fusion that trades one problem for permanent mobility restrictions and new complications. Gallbladder removal for stones that may never cause a single symptom. Coronary bypass for stable angina that clinical trials show offers no survival benefit over medication. And hip replacement for moderate pain with a 28% complication rate on revision surgery in a joint you were still using. My message is not fear. It is not to reject medicine. It is this. You now have information most people never receive before they make irreversible decisions. Your body's capacity to heal and adapt at 60, 70, or 80 is greater than the system gives it credit for. The most powerful intervention is sometimes choosing not to intervene until you are absolutely certain you have exhausted everything else. If this video was valuable, please share it with someone facing a surgical decision right now. A single conversation can change the outcome. Subscribe for more evidence-based health content every week. I'm Dr. Markus Dexter. Stay informed, stay empowered, and never stop asking questions. I'll see you in the next one.